Okay, we're going to get started. Thank you all for being here. This is another in the series of seminars from the Global Center on Childhood Obesity. We are very pleased with this seminar series, which not only are attended in person in this auditorium, but also they are webcast and attended by many people in many countries, actually. So it has become a very important tool in one of the missions of the center, which is education and training. And we have here Professor Taki Gusa, who is co-chair of the education and training core of the center, that will introduce our speaker today. I'm delighted to have Terry Huang as a visitor to our center. I'm sure Tak will mention this, but Terry was the reason we exist, because he wrote the request for application of NIH, from which this center was derived. So his vision and his understanding of the relevance of system science applied to problems of public health had been instrumental in making it possible to have such a critical center focus in this particular discipline on obesity. So, Tak, would you like to come to the podium?
Okay, I don't want to take too much of Terry's time, but I just want to say that really the whole idea of using systems science and systems thinking to bring a new approach towards public health, really a lot of that impetus came from Terry Huang when he was at NIH. And he told some of us how that happened. And he says that what he would do is he would go to the leadership at NIH and explain to them the importance of bringing this new idea of system science thinking towards public health problems. And he would do it again and again and again. And after a while, the leadership understood. So I think it's this persistence, and that's actually something that we in the research field have to do as well. So when we're doing our work, we have to follow Terry's examples, that we have to be very persistent. Our papers are going to be rejected and our proposals rejected at first, because there really is a pioneer. We're the pioneers. So really to move it forward, we have to face these rejections and eventually, get acceptance once they really understand the value. So we really are grateful to Terry for his groundbreaking work at NIH and his continuing work now at the University of Nebraska. And he's going to share with us some of his. I think it's the next step forward from the work he's done so far. So please welcome Terry.
Thank you so much, Ben and Tak, for your kind introduction. And of course, so many friends here. And it's lovely to see all of you again. I come here so often. I feel like, this is like a second home now. And it's always exciting to be here with colleagues who, on both the system side as well as the obesity and nutrition side, such amazing collaboration happening right here. And so it's really my honor to continue to be involved with the center. So I was here actually back in April giving a talk at one of the center's day-long workshops. And so I was thinking, I was talking to Dr. Tom Glass, about what I should cover today. I thought that, it might be nice for me to share with you some of my own evolution in my own thinking, and to showcase, how systems thinking can be translated into hopefully what you'll find to be interesting questions on the ground. So system science, is not just about modeling. That's a part of it, and it's a very useful tool. But I think even more important, particularly as we think about how we train the next generation of public health practitioners and scientists, how do we actually instill systems thinking in their minds so that they can translate that way of thinking into the kinds of questions they might might pose and the kinds of research they might conduct on the ground. So I will cover a couple of examples that I've sort of started in the last few years. They're ongoing studies, but hopefully give you at least a little bit of an intrigue, a sense of how one might go about doing the translational work that I think is so lacking and much needed in the field. So some of you may be familiar with this fairly high-level systems diagram showing the interconnections across different components, at a societal level, that impact individual behavior. We published this paper earlier, I guess last year, but what I really want to focus on actually are two components in specifically. First of all, I think that there is a lot of work that needs to be done on the interconnection between individuals and their environment. So what is that interface, right? So the field had gone from a very individually focused approach to, in the last 10 years, a surge of interest in environmental and policy interventions. And I believe the next chapter is about finding that optimal middle ground. How do individuals interface with the environment, and how does the environment interface with individuals? And when I say environment, I'm referring to both the built and social environment. And optimizing that middle space, I think is going to be key to the next generation of intervention design and testing. The second part I want to kind of focus on today with my examples is this notion of individual empowerment or community mobilization. So, oftentimes in public health, when we think about individual level interventions, we think about health education or skill building, right? But beyond that, are there additional questions or types of interventions that may even be more important to ensure that we optimize that interstitial space between individuals and their environment? And I would argue that public health has, at least in the chronic disease world, we have not done enough to actually think about how we can play in the space of mobilizing people for environmental and policy change, and ensuring that when environmental and policy changes occur, that people respond optimally to those changes. So you see that we're still working at the individual level, but the questions that I'm asking vary greatly from the traditional public health questions that might be asked at the individual level, which is focused more on knowledge and skills. With regard to health education specifically. So one important aspect of a systems approach is really about focusing on the interconnections. And these interconnections exist at all levels and across multiple factors and sectors. But social networks is important because in a systems approach, the capacity of every individual is actually extremely important, right? And so when I talk about social networks, I'm not only talking about, that behaviors are transmitted through, clusters of people, but questions such as, the density of social networks. We all exist in multiple social networks simultaneously. So when is one social network more important for a particular behavior in a particular context? That's also very important. And also, in terms of the level of capacity, are we matching the task to the level of capacity of the different players within a network? That's something that we rarely think about when we design and test interventions. And so I bring this out specifically to help us think about social networks more broadly and how that actually might factor into the kinds of interventions that I think will be needed for this next generation of research in childhood obesity. other key issues to consider. The capacity of the individual is important, but the capacity of the community is also very important, right? So a lot of interventions fail, and I would argue they fail not because they are bad interventions, but because those interventions have not been tailored to the level of community readiness. Many communities are in fact not even at the stage where they can benefit optimally from the kinds of obesity interventions that are being put in place. And so it behooves us to then take a step back and say, okay, well, maybe what we need to do first is to increase the level of community readiness before we introduce other clinical obesity interventions in the community. So the second area I want to highlight is the notion of implementation dynamics. So we can have the best environmental and policy ideas, but what really matters is what are some of the other issues that we need to take into account as we implement those environmental and policy changes. And so frequently, we can think of a lot of examples where the policy may be very sound. For example, we've had standardized nutrition labeling for a very long time in this country. Yet, survey after survey shows that people actually either don't pay attention to those nutrition labels, or when they do, they're not using them correctly, right? So here is a very good social policy, public policy, but there was something lacking in its implementation. More recently, a similar case happened with the introduction of the USDA school lunch standards, right? In principle, surely we would all support improving those standards. But what happened was the policy was then mandated. And then again, because not enough attention was paid to the implementation, there was a huge public backlash against the standards. Students were coming out with a viral YouTube video saying that they're going hungry and all sorts of things. And USDA had to then go back to actually refine those standards and reissue them. So I think that there's a lot around implementation science that is starting to bubble up on the horizon. And I think the center is well poised to actually take a leadership role in thinking about what are the kinds of implementation questions in research that we can do collectively to move the field of public health science in public health practice forward. The third issue on this slide I want to highlight is the idea of community outcomes. I think that we actually are not tracking all the things that we should be tracking. And this goes for the intervention data that we're collecting, as well as the national surveillance. So when the Robert Wood Johnson Foundation, for example, set a goal of reversing childhood obesity by 2015, chances are we're probably not going to be reversing childhood obesity by 2015. Do we then say that the efforts have failed? Surely not, because a lot of good has been done, right? But are we actually tracking all the right indicators to actually tell those success stories? And NIH grant is typically 2 to 5 years. And the kinds of research, the kind of work that needs to be done, maybe it would be unrealistic to expect that BMI will change, within that time frame. So what are we tracking besides behavior, diet and physical activity, that may be just as important, if not more important, to make sure that we are actually shifting the needle at a societal level. So I think, outcomes like public perception, public opinions about obesity, obesity-related policies, indicators of social change, of community capacity, these are all actually outcomes in their own right. They're not just process measures. And that's the point that I want to make, because I think the standard public health frame would say that, oh, yeah, sure, I get that. Those are just process measures. But in my view, they are actually outcomes in their own right. If we are talking about creating a systems change, then these are outcomes of systems. as a systems thinker, I increasingly think about issues of sustainability, scalability, and reach. There's so many interventions that may be efficacious, but their impact are not sustained, or that they are not disseminated and scaled up. And so the benefit that derive from those interventions, in spite of their efficacy, becomes very limited. And so I think as we embark on new research and new interventions, we should all ask ourselves, what can we do to ensure that we design sustainability and scalability into the intervention, from the get-go? It doesn't mean that you have to do everything in 5 years, but it does mean asking those questions and allowing those questions to influence how you might design the interventions from the beginning. And this is where I think involving systems thinkers from the outset of your research can be tremendously beneficial. And the issue of reach is also very important. How do we ensure that all communities benefit from interventions? There's increasing evidence to suggest that in spite of the leveling of childhood obesity prevalence at the population level overall, disparities may actually be widening across different community groups. And so back in Omaha, where I live, we, in spite of all the activities going on with CPPW or Community Transformation Grant, which are county-wide efforts, there's definitely differential penetration in different communities. And unfortunately, typically, the disadvantaged communities are also the ones that respond least optimally to those countywide efforts. And so, again, it goes back to the issue of community readiness. Have we paid enough attention to the capacity of those communities to ensure that they will respond optimally? And have we paid attention to the complexity around implementation to ensure that different communities will respond optimally? So these are important questions, I think, as a systems thinker, that need to be brought to the fore. So I already talked about that. From a systems perspective, individuals do matter. Even as we champion the importance of environmental and policy change, individuals still matter. And they matter because individuals are the ones that have to enact environmental and policy changes. Individuals are the ones that have to respond to those changes. So they can't only be seen as passive recipients of information. And I talked about capacity building. The notion of building trust is very interesting because typically in our kind of grant world, academic world, we expect people to come up with proposals and declare that they already have all the trust in their network of collaborators, right? And yet, nobody ever funds that effort. Nobody ever funds, the investment of building that trust, either just within the public sector across disciplines or between the public and the private sectors, let's say, because there's talk about the importance of multi-stakeholder approach. And so I would argue that, trust is a fundamental currency in a systems framework, a systems approach to any complex problem, and that building that wealth, as part of the foundation of your systems is actually critical. And so I think that there's a whole art and science behind trust building and behind how you create a successful and effective multi-stakeholder approach that is hugely missing in the current discourse, around obesity research. And so I highlight that as some food for thought. And also, because all the individuals in the system matter, no matter where they sit, whether they are just individual citizens or they're CEOs or government ministers, how do you actually operationalized efficiently and effectively through the distribution of responsibility and actions, that is a critical science in and of itself. And that's one thing that I think we're not doing so well in the field, in spite of the fact that there is a surge of interest in parties that are, getting into the game to tackle childhood obesity. There's not a whole lot of clarity around, what role each party should play to ensure that our whole is actually greater than the sum of its parts, to ensure that there is optimal synergy, across the system. And so what you find is then there's a lot of duplication of efforts, or that something falls through the gaps, and we're not performing as optimally as a system as we could. And finally, I would just say that the notion of creating a friendly competition used frequently in business to spur innovation and to spur change. This is something that we can actually leverage. We can actually build this into some of our interventions, which may hugely enhance the efficacy of some of our intervention efforts. I'll come back to this in a minute. So the goal is really to explicitly act on system structures and the feedbacks between those system components, not only the components themselves. And that's what separates a systems approach from a purely multi-component or a multi-level approach, in my view. So one example that's in the field is the example of EPOD. EPOD is one of the most successful and most scaled up primary prevention intervention efforts for childhood obesity. And it started out in France, but it has spread now to over 24 countries. And what has made EPOD so successful in terms of its impact as well as its scalability is the fact that it has it has from the get-go built in a system of distributed action and governance. And so you have, at the international level, EPOD International Network that then supports country-level central coordination. The country-level central coordination then supports the local coordinating teams within each community. So there are basically these three levels, three wheels, if you will, that are turning simultaneously and synchronizing as much as possible, and that has been proven to be a very essential model for the scalability and the effectiveness, of this approach. And certainly data coming out of Europe, have been very encouraging. So you can see that in France, over a long period of time, they've seen a 10% drop in obesity prevalence in communities that have that are receiving the EPOD approach versus controls. And follow-up study, longitudinal study, in 10 additional towns in France also showed a similar effect. In Belgium, data have just come out in 2 intervention communities versus 2 control communities, and actually showed an even greater decrease in obesity prevalence among kids. So I think it's very promising, and the key now is to think about, okay, so how do we bring something like EPOD to the U.S., given the difference in our social and political context, how we fund healthcare, et cetera? Those all play a role into, how we might need to adapt this approach to the U.S. context specifically. So I want to end this kind of initial kind of introductory part of my talk by saying that, when we talk about public health, oftentimes I feel like the public is being left out of public health. It seems to me that, the academics have done a pretty good job at talking with each other, and at times talking to the policymakers, and to some extent talking to the media, although I don't think we're terribly good at that. But we don't actually do a lot of talking to the public. And we certainly don't think about how the public can become active participants in the environmental and policy goals that we set, for society. And so in an upcoming paper, I partner with a long list of highly esteemed colleagues, to kind of bring this issue to the fore, and to really think about, beyond calling for policy actions and what each sector can do policy-wise, what are some of the things that each sector can do to mobilize the public for policy implementation? And I think that this is going to be a new chapter in obesity research that we will need to focus on increasingly. And so with that, let me go into a couple of examples where I'm trying to do or understand how you do some of those things on the ground in real communities. The first example I want to give is a project called the Saludable Omaha. It's focused on the Latino community. And the goal here is to grow or engineer a grassroots movement to increase the level of community readiness to address, issues like obesity and diabetes. And we know that in this particular community in South Omaha, the readiness is very low. We collected these data at baseline, and of course, it's not surprising. This confirmed what we had suspected all along. And so we then began to think about, okay, so how can we, how do we do this mechanistically? What do we have to put in place? So we built an initiative, which is ever changing. It's an adaptive initiative, a demonstration project, if you will. But the theoretical framework remains the same. It's really about nesting a social cognitive model in a model of social networks and social influence, and in a larger model of community mobilization. And so if you think about, these are kind of the three wheels, how we integrate, all of the efforts in order to actually impact on, to create social change, directly. So what does that mean in reality? We have essentially three key pillars. They are a very strong social marketing, social media platform, which really allows us to engage the community on multiple fronts. We have a institutionalized school initiative where we work with youth advocates, youth leaders from the local high school to provide them with the advocacy skills, but to allow them to be in the driver's seat to create social and environmental change. So some of the activities they have undertaken are mostly working on issues of the school food environment, but this coming year we're also planning to take them to middle schools so that they can actually spread the messages of Saludable and engage in some peer-to-peer knowledge transfer. We also have a strong neighborhood campaign, and that includes working with businesses. So we're about to launch a business tool in partnership with the Douglas County Health Department to bring businesses, local restaurants, Latino restaurants into the fold, allow them to become active participants in Saludable, but also use the healthy eating tip tool that we're asking business to adopt as a vehicle for social marketing. And of course, we're not naive to think that just because we're, providing some kind of interactive healthy eating tip tool, people will all of a sudden, start eating healthily overnight. But it is one foot in the door, and hopefully we can deepen the relationship with the local businesses. And then, once they're part of an active part of the initiative, we can then go back to them and help create incorporate more significant changes to their menus or to the way they run their business, et cetera. And all of this together is supposed to increase the level of awareness of obesity as an issue. We know from our baseline research that in spite of the county-wide efforts, there's a huge disparity between recognition of childhood obesity as a problem between, say, the Latino versus the mainstream community. And we also want to increase the mobilization of leadership, of resources, building again on youth leadership as a core engine, and then together to change the norms and the overall community readiness. So as we moved along over the next in the last 2-3 years, we began to really we try to expand our network of stakeholders, and different stakeholders, may have a slightly different, specific interest area. So some people might be interested in, food security, or they're interested in physical activity, and so we have to expand the framework, from where we started, which was a very specific focus on youth advocacy and community readiness. And so over time, we've developed this concept of a purposeful community. And so we thought we could get all of our players, buy into this notion of a purposeful community, because by impacting on these 4 constructs that feed into a purposeful community, they can all potentially see benefits in the specific outcomes of their interests, whether that's academic achievement or food security or good nutrition or obesity. And so we're now in the process with some additional funding from the National Park Service, actually. We're looking at compiling a set of metrics whereby we can potentially track constructs like social cohesion, collective efficacy, self-sufficiency, and readiness to act. And if we can monitor these things over time, these then become really important outcome measures for the good, the impact that we're having in this particular community. And at a regional and national level, we think that in an integrated, vertically and horizontally integrated model is key. So not only lining up our stakeholders at the bottom in terms of investment, local input, and logistical support, but also vertically with national organizations, not only in terms of funding, but in terms of knowledge transfer, which is so important. So Saludable Omaha was set up to actually be very amenable to become kind of like a chapter-based initiative. You can have Saludable Omaha Baltimore, or Saludable Baltimore, or Saludable San Antonio, for example. And so we've been working closely with the Salud America, which is a national Latino network, research network on childhood obesity. We've also been working with the National Council of La Raza, and Robert Wood Johnson Foundation and various entities, and with the idea that hopefully one day we'll be able to actually disseminate the model that we're testing, to other places. So I just want to show you a quick snippet of words from our own youth advocates, so you can hear from them why they are enthusiastic about being part of this.
Hi, I'm Lucia Rodriguez, and I am part of Saludable. As Latinos, we celebrate that we're the fastest growing minority, but here in the state of Nebraska, we're also the fastest growing diabetic and obese community.
Hi, my name's Andrew Martinez, and I'm from Omaha, Nebraska. Only 26% of Latinos exercise daily, and that has to change. Our attitude towards exercise needs to change. Our balance between diet and activity also has to change.
My name is Laura Magaña. I am from Mexico and I live in South O. I am taking part in Saludable because I want to help my Latino community better their health.
Hey you guys, I'm Jose Antonio Barrales. I'm originally from Mexico City, Mexico, and now living in Omaha, Nebraska. I am Saludable.
My name is Grace and I'm from South Omaha. When Latinos come to the United States, it actually leads to unhealthy eating for them and their family.
When our parents moved to the United States, they focused on giving us what they didn't have as children and accidentally overfed us.
Cultural eating is what's making our young Latinos overweight. And by
I'm gonna move it forward a little bit just in the interest of time.
Achievable, sustainable, and fun way to a better lifestyle.
We need to target policymakers who can influence our food industry. I personally want to inspire my community to not only see what's in front of them, but to have the knowledge and courage to challenge it.
Saludable's leadership will show by example that Latinos can live a more energized and happy life.
To do all that, you need to have lots and lots of energy. We believe in you. You can do this.
It's time to face our reality and move forward together.
So I'm taking part in Saludable to help kickstart a new generation of healthy Hispanics in America.
So saludable obviously means healthy in Spanish, but able actually stands for attitude, balance, leadership, and energy. And those are the motifs that our youth advocates have come up with and built into the initiative. And so when they're talking about needing a lot of energy, and that's really referencing actually the motifs that are core to how we operate. And so I welcome you to actually visit our website. I don't know if this will pull up. Oh, it does actually. And our website is designed to be obviously very interactive and very youth-friendly. And increasingly, we're also adding blogs and other information that is relevant to the parents, because we're actually increasing our outreach to parents and families as well. We also have a fairly active Facebook and Twitter site. And so please join us as friends, like us. And so I just kind of want to show you, give you a look, give you a feel for the look of our social marketing and how we communicate with this community. So okay, let me move quickly into the next part. So this all of my work is really about impacting culture and understanding culture and how we can actually, in a positive way, shift the needle from a cultural standpoint towards healthy goals. And so the next example I want to share with you is a project that I've been thinking about and working on for actually quite some time. And that is to work with designers and architects in completely reconceptualizing and redesigning schools. And the idea here is, how do we actually use design, spatial design, architectural design, to create a new culture? Particularly for young people, and a culture that will value wellness, a culture that will embrace the kinds of healthy goals that we would like to see. And so it was actually, we published the Healthy Eating Design Guidelines earlier this year, but the concept really stemmed from a 2007 article that was really more of a perspective piece on how we can design to rethink the architecture of schools to improve health. And the theoretical framework is, fairly straightforward. Environmental design leads to behavioral change, which then leads to social change and sustainable health. But what's important here is also all the feedbacks from the different circles back to the other components of the system. So we certainly don't think that just because you build it, people will come, right? We know that that's probably not true. And so how do you actually integrate environmental design with a social design to ensure the long-term sustainability of behavior change? That's also a very big part of this. So there are 5 essential elements for the cross-sectoral collaboration, and this is important. And we actually, made sure that this stayed in the final publication of our paper earlier this year, because it's not trivial. As I mentioned earlier at the beginning of my talk, building these collaboration doesn't happen overnight. And so what we distilled from several years of engagement with designers and architects was that we had to actually unify our mission, our vision, our goals, and our values. We needed to identify required skills and resources, and we translated a lot of these actually into a written agreement, a contract, which we then, all kind of implicitly signed, and focusing on connecting conceptual and practical considerations. And this is important for public health practice, right? Because not everything that I think as a scientist is a good idea is actually feasible or even relevant from an architectural practice standpoint. Development of a common lexicon, that was actually not trivial. It was a lot of fun to learn about all the words that they use and what they, and what that means for the public health concepts I want them to incorporate into the building design. And then finally, creating an open and iterative culture for exchange of ideas. These are, I think, very essential elements that require time and investment to build. The principles of our design include these. The provision of equipment and spaces that facilitate the incorporation of healthy food choices in physical activity opportunities. That's pretty straightforward, makes sense. Provision of facilities to directly engage the school community. Application of behavioral economics principles where possible, and this is where kind of the concept of choice architecture or nudging come into play. Use of building and landscape features to promote awareness of health and sustainability, and this is where having the co-benefits being brought into the picture becomes really, really important. The school was actually, the prototype school that I'm going to show you was actually originally slated to be renovated in order to become a LEED certified school, environmentally friendly school. And we came along and said, you know what, we can actually get multiple birds with one stone. What about thinking about environmental sustainability as well as, healthy designs? And so keeping that in mind as we integrated the different design elements became very important. And then finally, the conception and articulation of school spaces as community assets to multiply the benefits of healthy school designs. So the school doesn't exist in isolation, but the school is really a part of the community. And in fact, I would argue in many instances, the school can play a central part in changing the culture of the surrounding community as a whole. And that's certainly true in the prototype school because it's a fairly rural and low SES community in Central Virginia. It's the only elementary school in the county. And so it is very much a place where the community congregates. So the design, again, translating concepts into space, into spatial articulation. It was actually very hard. And the 10 domains that are incorporated into that spatial map include, this is for the diet part, include obviously the kitchen, the cafeteria, the dining area, as you would expect. But what you might not expect are things like signage. You wouldn't think that signage would have much to do with this, but actually it does play a very important role. Water access, food production, integrated healthy food education facilities, as well as integration with the surrounding community. And in addition to the diet, we actually just presented the physical activity design guidelines last week at Obesity Week. And the physical activity design guidelines include also 10 components: active classrooms, active navigation areas, smart fitness facilities, active play areas, outdoor learning areas, active furniture. So we actually incorporated furniture specifically designed to promote micro movement. And we're using accelerometry in a subset of the kids to see if we can actually detect any trends in terms of increases in light activity. Technology support. This was not as well articulated in this particular school, but we think it's important, as part of the guidelines, because remember I talked about from a systems approach, competition is very important. So imagine if we could actually incorporate electronic dashboards for real-time feedback on, let's say, the activity levels, across different classes, or the level of the mood, the level of happiness, amongst kids in different clusters, different classes. I think that kind of feedback could have a tremendous impact on the overall climate, the culture, and individual behavior change. And this didn't come out of nowhere. Those of you who've been to these I think fitness classes like Crunch, the Crunch gym, in New York. If you're in one of those spinning rooms, they actually have these dashboards showing how fast and how, rigorously, each bike is actually performing. And you can imagine the adrenaline rush and the competition that happens, during those sessions. And of course, from psychology, we know biofeedback is actually important. It does make a difference in terms of one's performance. And so I think that there's a lot that can be explored in this area. Again, community connectivity and also thinking about the massing of buildings. So if you're going to put in a school ground, that school ground shouldn't be in a location next to a building where, for example, the building might be blocking all the sunlight, right? So this is where the proportionality of the design of different spaces throughout the school actually becomes really, really important. And finally, also signage as part of social marketing, but also as a way of nudging activity. So for example, we put in little geometric shapes, on the wall. They don't really have any meaning. It wasn't there to convey a piece of knowledge or anything. But we knew that when kids walk by, they will want to jump up and touch those little geometric shapes on the wall. So those are the kinds of things where you can basically embed default physical activity into the environment because of our designers' insight into how people will behave according to different features within the space. So I love that. Design really does play a role in how people behave. It really shapes how we behave. So here are some photos of actually little wooden placards that are displayed throughout the school, and so we provide it's part of a learning process as well in the way we think about the design of the school. And again, just creating a different attitude and a different value system about what it means to be healthy. And here are some pictures. There are a lot of these nooks and crannies built throughout the school. They're used as play space, they're used as reading space, they're used as small group activities. Here's a classroom, and you see the furniture is very modular. These chairs that promote allow kids to move, to have micro movements in an ergonomic way. I don't have any pictures of these hockey stools. They're like little stools that wobble, but designed so that kids won't fall over. Yet they're constantly fidgeting in an ergonomic way. These are, again, learning spaces and activity spaces. They're designed to actually be like a forest. They're canopies. And you'd be surprised at how much use this particular area of the school actually gets. So you can measure a lot of things. You can measure, policy and practices at the school level. We can certainly measure staff, attitudes and beliefs, and we can also measure, to some extent, student behaviors, psychosocial outcomes, as well as, dietary and physical activity behaviors. And we're doing most of these things in our evaluation plan. So just, at baseline, I don't have the outcomes data for you today because we actually just collected them last month and we're still processing all the data. But certainly at baseline, we know that many teachers and staff are unsatisfied with their own personal health and wellness. And a large proportion of them are also unsure about whether schools can actually play a role in influencing children's behavior. So there's definitely room in this particular school for us to create an impact. Teachers and staff also appear to blur differences between what students are actually offered in terms of food, the students' food preferences, and versus the reality, and there's a lot of tension between which context influences students the most, and that's not surprising. Student eating behavior generally very poor, mostly packaged, frozen, reheated foods at school. So this is a continuing area for improvement. The cafeteria staff in this particular school actually don't have any nutrition background, and that really surprised me. Actually, not a single person, and so teaching them how to actually, practice completely differently has not been an easy endeavor. And I want to show this because it's hard to collect data on kids, especially young kids. There are not a lot of well-validated measures for use in young kids. And so we adapted a methodology from psychology, and we asked kids to actually spatially draw spaces in relation to food or physical activity. And so you can see that this is just one example from one student. There are a lot of gaps in perception about what a healthy food is and what they usually consume. And students also draw these cafeteria spaces to include tables, but largely void of kitchen or people. And so the conceptualization of eating as a socially engaged experience, as a wellness activity, is really completely missing at baseline. And these are based on the old school before they move into the new school. So it'll be interesting to see what happens to our outcome data, whether these drawings come out really differently. I'll keep you posted. Let me just show you a quick video.
As a pediatrician, my job is really to think about children's health broadly. In this project, what we're trying to think through is how can we use the design of the school building itself to help promote healthy behaviors and long-term attitudes about things like healthy eating and a culture of physical activity that, yes, influences the direct behavior of children in the school today, but most importantly, influences the way they think about both healthy eating and being physically active for the rest of their lives. Everyone in this project was doing something brand new. They were definitely using their expertise, but in a totally new way. And for Terry and I, this was a chance to apply some theoretical ideas that are evidence-based, but definitely theory, that the design of a school could be utilized for something like obesity prevention.
This is the Carter G. Woodson Education Complex in Dillwyn, Virginia. On the left side is K through 2, and on the right side is 3 through 5, and we have about 960 students total.
We took a school, obviously one of the community's most treasured resources, and really tried to apply thinking from public health, from design, from education, from environmental stewardship, a lot of things that haven't necessarily been combined, and boiled it down to a set of design guidelines and now a real building.
And working with the design and research team, we identified every nook and cranny inside and outside of the school, the color palette, the materials, the furniture, all the experiences a child has throughout the day became meaningful and rich with opportunity to promote health.
We have a multi-purpose center that has a soft floor. It's this huge open gym. We have a full basketball court. Our art, music rooms, just are really healthy spaces for kids.
Our children love the openness of the cafeteria, the restaurant style. The kids seem a lot happier now that we are in this new building. The openness of it, having all the windows and letting in all the sunlight, has really uplifted, I think, their moods as well as the teachers.
This is a building that's really child-centric. It's not trying to keep them in one particular space or in one particular seat. The entire building is a classroom. A kid is a kinetic, excited entity, and many of the design decisions that have been implemented here, including all the way down to the furniture choices, are meant to let the child move.
There are specific aspects about health, such as childhood obesity, that we can create design features around to promote change in that area. So as a whole, those small acts of design have a big impact.
Our community loves it, but I think more than anything else, they love it because the kids are going home saying that they love school. Other schools around the country should come look and replicate what we're doing here. I think that the activity and the healthy choices really goes to supporting our academic goals, and it's exciting.
I think all of us recognize that the spaces in which we inhabit, where we live, we work, we play, they can have a tremendous impact on how we behave, how we think about things, how we socialize.
So we have to put kids first and do whatever it takes to give them the opportunities they deserve. And they deserve to have a healthy start to their lives.
In the interest of time, let me just move forward quickly, just 2 more slides. I mentioned that most of my work is really trying to study and to intervene on that interstitial space between people and their environment. In other words, to really understand culture. And so some additional research activities that are exciting and that are happening with my group include a new pilot project we're going to be launching this spring, integrating systems methods with actually methods that borrow from collaboration science and methods from communication science and anthropology to help us better understand food culture. We've also done quite a bit of work around actual modeling, simulation models, to generate new hypotheses and to inform public health policy and practice. A very recent paper looked at the relative importance of prevention versus treatment, focusing on adults and kids, building in the social transmission between adults and kids, and how all of that collectively impact the prevalence of childhood obesity. Just came out in +1, so you're free to look that up. And increasingly, we're thinking about how we actually apply design thinking to community health problems using methods that designers use. And so in conclusion, I think that we really need to strengthen the system structures that connect actors and the factors that underlie the complex obesity system. In other words, this is kind of akin to the concept of greasing the wheel. And again, this takes effort and time. Culture change, I think, is difficult, but really key to improving the system. And until we address that head on, I fear that we're not going to be able to make a large dent in the status quo. Dynamics and interdependencies really exist at all levels. Therefore, there's a huge importance in figuring out how to integrate bottom-up and top-down approaches. Ideally, if I could combine Saludable Omaha with the school design, I think that would be super duper. Maybe that's the next proposal. And I think we need to shift to a solution-oriented paradigm, and we need to address the context. And then finally, I would just leave you with this thought, as more and more products and services are moving towards what's called human-centered design, is it not also time for us to think about and move towards a human-centered public health? So with that, I would just acknowledge my funders and my many, many partners. Thank you. Are there any questions? Yes, Bruce. Right.
Areas that you feel that we need to have better advocacy and try to overcome some of these challenges?
Sure. I would say the biggest challenge is really, this is probably a challenge for everybody in the room, but getting, I think, funders to buy in and really allowing funders to see the big picture, that's always a challenge because, it's very difficult to sell system science in a way that create very clear deliverables, that in the way we typically think about deliverables, from a reductionist standpoint. And so articulating the methods and articulating the actual outcomes, what are the benchmarks? I think that is an area ripe for development. And actually, maybe this is something that the center can actually help the field to think about. And so how do we measure the success of a systems approach, right? That's, I think, actually a very important philosophical question. And on the ground, I would say that with the school project in particular, building the capacity amongst the different actors, not only the designers and the public health practitioners, but actually, in terms of the school, the teachers, the staff, that's an ongoing battle. I alluded to this already, that again, they're very busy. They're focused on their standardized tests. They're focused on, feeding 960 students. They're not interested in thinking in systems with me. And so how do we, over time, instill that culture, of systems thinking and that culture of working cooperatively? It's not easy. I feel that in and of itself almost requires another proposal, another intervention, right? But our funding is limited, was focused mainly on working out the designs and doing kind of this evaluation, pre-post evaluation. There wasn't actually a lot of money allocated, for the software programming. So all the software programming that we've had to do really was just based on unfunded, time. So I send PhD students go live there for 2 months and work with them on a day-to-day basis. We work with the U.S. Green Building Council, leveraging our multi-stakeholder partnerships, to basically come up with a student-led guided tour, because we want the students to, as young as they are, we want them to gain ownership in their new school. And so we borrowed this idea from the U.S. Green Building Council, around a guided tour. So we, put together this guided tour, and then basically, it's amazing to watch these second graders actually give a tour of the school to visitors, and how through that process they have completely merged with the space, how they identify and interpret the meanings, of the space. Absolutely incredible. And so, but those kinds of activities are all extracurricular activities that take a lot of time and effort. And in the next iteration, I would argue that, those would need to be explicitly included, in the proposal or in the intervention, because they're so critical to the ultimate success, of the space. So I don't know if that helped answer your question. Yeah.
What are some of the qualities or indices that you're going to measure from the previous school to this school?
Right. Yeah.
Besides, of course, BMI.
Yeah. So all those baseline measures we're repeating. And I didn't show you any of the accelerometry measures, but we also collected those in a subset of the kids. And I wish we had included more measures about cultural values. It's a little challenging because it's elementary school kids, so it's hard to measure those in young kids. But we did collect a lot of qualitative data, a lot of kind of ethnographic and field observations, and hopefully we can extract, some indicators, from that data set to show whether the students are interacting with their space differently in this new school versus the previous school. So that would be one way for us to detect some of the cultural changes. And, the most rewarding thing for me, actually, which is not scientific, but I think it's hugely impactful, is that the kids actually really love the school. They love school not because they love this school, but they love school. They love going to school. And I wish that we had somehow figured out a way to capture that. I suppose we could look at some academic outcomes and truancy and those kinds of things. But the most rewarding thing for me is to see this low SES rural community and the kids that in this community actually loving school so much that when they're not in school, they miss school. And so I think to myself, even if we have no impact on obesity, the fact that, we've instilled a love for school amongst these kids, the myriad positive benefits that will come out of their loving school, it would be just incredible, So anyway.
Can you address a little about the parental response, what their engagement level was like before, or perception of school and their role with school and the family,
Mm-hmm.
how it shifted, what did that have to be like?
Yeah, so we're actually not actively measuring the parents. Again, part of our just resource limitation. But anecdotally, we know that parents are obviously they love the fact that school exists, and they obviously appreciate the fact that their kids are interested in going to school. I would say that they're not, we have provided a lot of technical assistance and a lot of workshops, for parents and other community stakeholders over the years. But we haven't actually involved them explicitly in the operationalization of the school. So any kind of change of school practices and whatnot, they have not been as integrated as they could. One example that does come to mind is when we were putting in the school garden. We did get select parents involved, and they're not as involved now in the winter, but they are involved during the warmer months in maintaining the garden and setting things up, planting and those kinds of things. So that's one area where I've seen active participation. It's challenging because it's a low SES community. Even just getting hold of the parents sometimes is very, very hard.
Have you changed any, like the PTA involvement or showing up for PTA,
That's a great. That's a great. We probably can get that data. I'm thinking, the teacher probably has some kind of attendance sheet. Yes. I like that concept very much. I'm going to look into it. Thank you. Yes, Eli?
You talked about community readiness and how that's really important in terms of maximizing the impact of any intervention.
Mm-hmm.
I'm thinking about, in particular, within the Baltimore City context, there's a very unique history here.
Mm-hmm.
What are your thoughts about ways for, improving that level of trust and enhancing community readiness? And also related to that, how do you go about measuring?
Right. So we're using Edwards and Plested's community readiness model, which is a very standardized and well-validated, measurement of our community readiness. I actually think in the case of Baltimore, the application of a design thinking could be very, very interesting. So we just wrote a proposal to basically form local design teams. So these would be non-designers, like from the community, schools, public health agencies, et cetera. And we would actually create design teams out of them and adapt methodology from the Stanford Design School to facilitate a 2-year-long process with each community using design thinking. And so the output would be locally identified barriers to implementation of some kind of evidence-based strategies. In our case, we're interested in school obesity prevention, and to come up with locally driven solutions. And so it would be interesting to, I think, see if that might also work, in an urban environment in Baltimore. For us, our proposal is we're looking at both urban and rural, but there may be some differences between the two. But anyway, it's a thought. I can't tell you that it will work for sure. It's worked in a lot of other industries, other fields, but this is new. It hasn't been done in public health. But I think what I love about design thinking is that it provides a systematic framework and set of steps and set of tools to structure community engagement and to move towards kind of a human-centered design, whatever the product might be. Anyway, if you're interested, let me know. I'd love to try it out here in Baltimore. Yes, Tak.
It's very impressive. Your idea is very impressive. So I'm looking at it at a meta level. So how did you come up with the idea that architecture can influence obesity? So I'm a civil engineer. So
Yeah.
We couldn't even dream of this.
So back in the mid-2000s, there was a surge of interest around the built environment, and that interest remains today. But most of the work around built environment is actually around urban and community environment, not so much about environment at the building scale. Yet we know that there's a long history of thinking and practice and research around the influence of building scale design on, for example, mental well-being or even school achievement, cognitive, outcomes, as well as social interaction among kids. So we did a thorough literature search and developed this paper that was kind of part review and part perspective to argue that perhaps there's also a way to influence health behaviors like diet, physical activity through design. And several years later, New York City, of course, came up with the active design guidelines for New York City buildings, affordable housing in particular, which had really good traction in the community. And it was just one kind of whimsical idea, built on, again, looking at literature across disciplines, but then got reinforced by what other people started to do. And next thing I knew, we were building a new school in Virginia. And, I think, good collaborators that came along. Some of them knocked on my door because they read my paper, and others we kind of bumped into serendipitously, and so, yeah. Not in this school, but I think that's huge. And this is where I was thinking about that, like for the dashboard, so this is my next school, so if you know of any schools, let me know. I need 2 years advance notice because it takes that long to design this school. Once they get into the construction schemes, it's too late. But I think, the whole construct of happiness is hugely fascinating. And I wish that we could explore that further, integrating happiness research into our interventions and the outcomes that we look at. Yes. Yeah. Right. I agree. Yeah, but see, I think in kids, to measure happiness, because most of the happiness research is on adults, right? But in kids, maybe we could have some kind of like mobile device, where they could push a button, to indicate their mood throughout the day. Wouldn't that be cool? And then it would show up on a dashboard, and teachers can react according to. Both teachers and students can react according to, what the real-time data are showing. So actually, this is kind of fanciful, but actually I am in discussion with an engineer, who is very specialized around mobile technology, and so maybe we could, in the foreseeable future, we might be able to do something and test this idea out. Yeah. But also you need to, integrate it with the feedback. So. Yes.
Just in terms of having an intervention on a structured, homogeneous environment like a school, are you evaluating what happens on transitioning some of these health behaviors into non-homogeneous outside school environments? Because you're there's this highly rich environment that propagates health behavior, but when you go outside, you have different peer groups, different social circles. Do some of these behaviors disappear because there's environmental deprivation outside?
Right. That's a great question. So that's where I think integrating design, at the building scale and at the community scale become really important, and also integrating concepts like Saludable Omaha become really important, because it is really about integrating the top down and bottom up, where you have to increase the capacity and you have to create social environmental change throughout the system. We haven't done that integrated work yet, but that is the idea, and your point is very well taken. So these kids may love school, but when they go home, do they still carry the same value, that they've acquired into the home environment? That remains a question. Yeah. Yes.
In terms of this, I'm sorry if I'm saying it wrong. But,
no, that's fine.
As part of the global center for OBC, a lot of the work we do internationally tends to be in
yes.
that are highly migrant, they're not stable at one environment.
Yeah.
So the lack of social cohesion or social capital, staying in one place is not there, where there is subcultures but not necessarily tied to the community of the place itself.
Right.
So how do you suggest building these groups of communities when the population is always transitioning based on economics or migration?
Yeah, it's a very insightful comment and question. So I think social media could potentially have a role to play, and it's still a bit untested as to how you cultivate communities using technology in that particular population. But I think it's worth thinking about and trying out. Our population, although yes, it's relatively stable community, but they're actually, the engagement level is very in and out. It's not a reliably engaging, population. But I do think that, using the power of, mobile technology in developing countries, mobile technology is even, it's perhaps even more prevalent than PC-based, internet access. I think it has tremendous power, and how. But the question then is, again, how do you measure engagement, and how do you then use that indicator, to adapt your intervention going forward? And I think the science is still in its infancy, and it's definitely ripe for further research. Okay, well, thank you so much. Thank you for being here. Thank you.